Well, have you ever felt sad or depressed during the winter months? You're not alone. You could be experiencing SAD, seasonal affective disorder. In this week's Your Community Health with Arnett Health, WENY's Renata Steele talks with a doctor about how to cure the winter blues.
Hello and welcome to this week's edition of Your Community Health. I'm Renata Steele with WENY News, and I am talking with Dr. Richard Terry. And Dr. Terry, we are talking about a topic that is pretty seasonable, and it affects a lot of people this time of year, and that's seasonal affective disorder, commonly known as SAD. First of all, tell me a little bit about what that is.
Well, basically, it's when the daylight time, like it is now, becomes to a minimal amount, like less than 8 hours a day. It's dreary, often rainy or snowy. Patients become depressed or their mood changes. And it is a diagnosable condition basically related to a lack of sunshine, which we do have in this area, particularly in the winter. So it's a very real disease with criteria to diagnose it. The good news is, Renata, it is treatable. And I think if folks are suffering from that, where you seem like you're blue most of the time, no energy, don't want to get out of bed, don't want to eat or want to eat too much because you're feeling depressed, then you may very well be suffering from seasonal affective disorder.
And if you're feeling those sort of symptoms, when should you know, okay, this is something I should talk to a doctor about?
Well, I think the onset of this, don't let it progress into something else. If you're noticing a change in your behavior, or your family's noticing a change in your behavior, you should seek medical attention immediately and address it, because the reality is there are treatments, and some of the treatments can be light therapy, actually are available. Various things are available that can be helpful with this condition, and also, of course, pharmacotherapy can sometimes be helpful. Some of the traditional drugs we'll use for depression, serotonin reuptake inhibitors, for example, Prozac, Celexa, sometimes can also be used, on a seasonal basis to help carry people through this difficult time when they're getting through the holidays, not a whole lot of sunlight. These medications can in fact help sometimes.
And in this area in particular, we do see a lot of this. This time of year, there's a lot of just gray out there, that comes with the winter. And, is this something that you see in your office with some of your patients that they're suffering from?
Absolutely, I do. And I think that the most important thing, if the patient shares those symptoms with me, we'll recommend a treatment. And sometimes, it doesn't necessarily have to be a medication, but those can be helpful. But as I mentioned, even light therapy has been studied in this condition, and in and of itself can be very helpful.
All right, well, Dr. Terry, thank you so much for your insight on seasonal affective disorder, and we'll put some more information on our website, WENY.com. Thank you for joining us for this week's edition of Your Community Health.